Hi, I'm John Vickers. Today I'm going to talk to you about pulled hamstrings and some solutions that you can do to help alleviate the pain and also to help prevent it from getting pulled again. So I have 4 other videos that I've done that specifically show causes of pulled hamstrings. It would be good for you to go back and review those videos and see which scenario is best fits your circumstance. Now, before I say anything else, I also want to say if you pull your hamstring and it's not getting better with just simple rest, it would be best if you go see your healthcare professional first, because at least your healthcare professional can give you a hands-on experience directly related to what's happening with you. So now, having said that, I'll give you a couple things that you can do that will help to alleviate your pain. First, you can use, if it just happened, you can use ice on it. If it feels really painful, you can ice it. And you want to ice it for 10 to 15 minutes, and you could do that until you feel that the area gets numb. And then afterwards, and again, this you'll have to check with your medical professional, your doctor. If you can take an over-the-counter pain pill, then or anti-inflammatory, you can also do that. In addition, you could even wrap the hamstring with an ACE bandage, and it doesn't have to be tight pressure, but just enough to help give you support. So those are some simple things that you can do to help alleviate the pain. So now, as far as exercises that you can do, again, you have to look and understand what your cause is. But probably the number one thing, the thing that I see most common, is that the hip bones are generally out of place. And an easy way to determine whether your hip bones, and when I say that, I mean that one hip bone may be rotated more forward or anteriorly, so it's more rotated this way, which takes this end of the hamstring away from that end, creating a pull. And so if you have to do anything explosive in movement, lateral motion or forward motion, then that can create this pull in your hamstring. So in a malposition of your hip bone on this side can create that in this hamstring. So like I was saying, your trunk muscles, since they attach to your hip bone, they're going to be the ones that probably create this malalignment of your hip bone. So one simple thing you can do is you can sit in a chair and you can check your rotation. So I could sit and I can rotate my torso as far as I can to the right, and then I can sit with my hands on my chest and rotate to the left. If I have an imbalance between my right and my left, then I can be pretty sure that I'm going to also have an imbalance between my hip bones. And that will be something that you will go need to see a therapist about, getting these muscles balanced again to help alleviate this issue. So that's number one. So that will also affect the internal rotation, that scenario. Because if this guy is out, if this guy is in a poor position, and my trunk rotation is limited, that will definitely affect my ability to internally or externally rotate, which is going to affect my hamstrings. And again, I'm going to need to see a professional to really restore this balance so that this is in the right position, which creates my hamstrings in the right position. And then the next scenario, as I talked about, was internal rotation, which kind of piggybacks again off of the trunk, because in addition, I also have hip muscles that attach onto the top of the hip, that attach onto the femur. That's going to affect my internal and external rotation. And again, that's going to definitely affect my hamstrings. So that would be another situation. And then the last circumstance that I talked about was your ability to dorsiflex at the foot. And if you're limited in this dorsiflexion motion, that is also going to affect you at your hip, and it's going to affect you in your trunk. So a simple thing that you may be able to do, and that is if you don't have anything going on with the trunk as far as your rotation is equal, you could also just do a very simple exercise where you just flex your foot. I would sit in a chair and I would have my foot flat on the floor, and I would just try and flex my foot towards my head. And I would hold that. And what you want to feel is you want to feel your shin. You want to feel the muscles on the front of your shin working. If you feel that they're working and contracting and you don't feel a lot of tightness in the back of your calf muscle on the backside, then that will help you. So again, it would just be sitting, flexing your foot towards your head and feeling that these muscles engage. No tightness in the calf. If you feel this working, you hold it for 6 seconds, trying to do 10 reps. That will help alleviate and help to give you better dorsiflexion, which will help with your internal rotation of your leg, and that will give you some relief of your hamstring. So once you've corrected these, then you can do some of the traditional simple hamstring strengthening exercise with either a machine, or you can do a simple hip raise exercise where you're lying on the floor. If you have any questions about hamstring pulls or pulled hamstring strains, or hamstring tightness, please don't hesitate to send an email to me at johnvickers@jvfitness.com, or you can leave a comment below. Thank you.